So when discussing pharmacokinetics, there are a number of principles to consider. We have absorption, distribution, metabolism, and elimination or excretion. Absorption is what it sounds like. It's how the drug gets into the body. So typically drugs that are taken are absorbed in the gastrointestinal tract. So if you have a tablet, for example, that's typically how it's going to get absorbed into the body or into what we call systemic circulation, which is the blood. But it can be inhaled through the lungs or through the skin, so transdermally. And all of these would require a type of absorption to occur. If something is given intravenously, however, then that drug would not need to be absorbed because it would already be in the systemic circulation, in the bloodstream. Distribution is the movement of the drug once it's absorbed to different parts of the body. So depending on the drug and its properties, a drug can end up going into the bones, the fat, the central nervous system, etc. And for drugs that are used in psychiatry, it is ideal for the drug to have properties that allow it to enter the central nervous system so that it can exert its mechanism of action where we need it to. Drugs are also broken down in a process called metabolism. Not every drug is metabolized, so if it's a very simple drug that doesn't require further breakdown so it can be excreted or eliminated, it may not actually be metabolized. Sometimes metabolism is also helpful in making the drug active. So some drugs we actually take that as they sit, they are not active, they don't work until the body uses the liver, for example, to break that drug down into something that is active and will work. So there is a dynamic effect going on, and dynamic means, moving around back and forth between things like distribution and metabolism. So it's not a linear process going on. At the end of the line, we have elimination, which is the removal of the drug. So most commonly, we'll see elimination in things like the urine. So that's why you can take a urine drug screen for a lot of substances. It can also get excreted within the feces, as well as expired through the air. So there are a number of different ways that the body removes that drug once it's metabolized to a point that it is easy to do so. So looking more detailed at absorption, it can be defined as the movement of a drug from its site of administration into the blood circulation. So really, it has to get into the blood in order for the drug to work, particularly with our psychiatric drugs. There are a number of things that can impact the drug's ability to be absorbed. So the GI blood flow, the stomach's blood flow, if it's got poor blood flow, that can affect it. Sometimes food can affect the ability of the drug to be absorbed. So it can enhance or restrict the absorption of the drug, depending on the agent's properties. There are also enzymes that can affect absorption. The pH, or the acidity or basicity, if you will, of the stomach or the gut can affect it, because sometimes there needs to be certain ions in the gastrointestinal system in order for the drug to be absorbed appropriately. And then sometimes interactions with other drugs. So for example, there are some antibiotics, particularly doxycycline, which can be used for a number of different types of infections, that actually will bind with stuff like antacids like Tums and make it so that that drug cannot be absorbed in the stomach because it's all bound up with another drug. So if we're looking particularly at the oral route of administration, which is probably the most common one we think of, we also refer to the oral route as PO, or by mouth. There are a lot of benefits to taking a medication by mouth. It's easy. Patients and providers don't mind prescribing oral medications because it's taking a pill. It's not too bad. Usually the development of oral medications is much less expensive than certain types of injectables, for example. Doesn't typically cause any pain, and there's no risks with administration. So things like infection that we consider if we're giving something intravenously, it's really not going to be a concern with the oral route. However, there has to be a lot more stability of the drug. So that's a con, right? We need the drug to be okay for a long period of time without breaking down in order for the drug to be able to be dispensed in a pill form and taken appropriately. This also means that the drug has to be absorbed through the stomach, And it can be a slow process that's sensitive to all those things that we just mentioned, like pH, food, etc. So depending on the drug, that can be a real problem for patients that need specific restrictions in how they need to take it. It's much more likely to get metabolized by the liver through something we call a first pass effect, where there is actually vasculature or blood vessels that go directly from the stomach to the liver, which is our primary filter type of organ that breaks down and metabolizes drugs. And of course, just that risk of absorption not occurring. So on the other side, we do have the injectable route, and injections are great because they go directly into our circulation, essentially. So there are a number of different ways that we can sort of get that drug into the circulation through an injection. So the most common one you think about is IV or intravenous. So intra just means into, and whatever's next to that is going to be the place, right? So intramuscular, intravenous, intrathecal, all of those are into various places. Subcutaneous is also a common route of administration, particularly for drugs like insulin. And it's essentially injecting into the adipose or fat tissue that's located between the skin, so below the skin but above the muscle. So it's different than an intramuscular injection. However, this doesn't absorb quite as well as if you're going to put something directly into the vasculature or the blood vessels. So it tends to have a slower onset. They also tend to have to be an oil-based drug and can only really be for a very small volume. So we do know that you can't inject very large amounts of drug subcutaneously because it's going to be quite unpleasant, quite painful for the patient. So we're really limited in terms of volume of the drug that we can give. Intramuscular allows for a little bit more volume, but still pretty small volume. So if you've ever had a flu shot, it's a pretty standard volume of injection that we can put into the muscle without it being terribly uncomfortable. And it tends to have a slightly more quick onset compared with subcutaneous. Does tend to be good for oil-based drugs like with subcutaneous. And again, because you're injecting directly into a muscle, muscles are a little bit sensitive to pain. So we do tend to have a little bit more experience of post-injection pain with an intramuscular shot than if we would compare it to something like a subcutaneous injection. Intravenous goes directly into the vein. So this allows for the most rapid delivery to that site of action. And it allows for a lot more control because we don't have to think about things like muscle mass or fat mass in a patient. We can literally just give it straight into the systemic circulation, which is very nice. One of the difficult parts of it, of course, is you have to be able to get to a vein. The injection itself can be quite painful during the time of the injection, and it's hard to pull that drug back out if there is, for example, a mistake, an unfortunate mistake. That drug is staying in the body. We'd have to find creative ways to get rid of it. Intrathecal route is a very uncommonly used way to administer drugs, but there are some instances where we will do things intrathecally. And essentially what that means is it's into the cerebrospinal fluid. So you remember from previous lectures, the cerebrospinal fluid is one of our safety mechanisms of the central nervous system. We don't like a lot of weird stuff going in there, but occasionally we might put a drug in there. And what's nice about that is if we put a drug in the intrathecal space, it does not have to bypass the BBB, which is, as you probably recall, the blood-brain barrier. So most drugs have to go through this sort of protection in order to penetrate into the central nervous system, where if we give it intrathecally, we don't have to worry about that. Now, there's a lot of risk involved with intrathecal administration of drugs. You need to be very well trained in order to do it. And there's a much higher infection risk and a bigger risk when it comes to the type of infection. So we can experience things like meningitis, for example, if injection techniques are poor and the cleanliness is poor. So intrathecal is not nearly as common. Other routes to consider, so there are other ways that we can give drugs, but orally and an injection is probably the two most common ways. However, These are some of the abbreviations and types of ways that we can give drugs. So PR, or per rectum, into the rectum. So the rectum is very vascular and actually has a very good absorption of many drugs. Topically, so across the skin, and sometimes we use topical drugs without the intention of absorption. So we might use a skin cream to help with a rash, for example. We don't really want it to be absorbed. And then there are drugs that we do want things to be absorbed through. So like if a patient needs a nicotine patch, for example, that's going to go topically, but actually get absorbed across the skin. Inhalation, so inhalers, there are a lot of different kinds of inhalers available that perform a number of different functions. So we can inhale certain types of medications. We can also take medications buccally or sublingually, so SL, which would be under the tongue. And if something is buccal or sublingual, then that's going to be absorbed actually through that oral mucosa. So we don't swallow the medication. It actually goes through the vasculature within the mouth. Like I had mentioned, transdermal is similar to topical. So usually it's a patch, however. And then we have IO, or intraosseous, and this is usually reserved for critical care or emergency situations when intravenous access is not available for whatever reason, or the speed with which intravenous access is needed made it so that they switch over to intraosseous. So a lot of times if someone is imminently perishing and requires quick administration of drugs, it can be easiest if they're a hard stick to get a vascular line in, they might get an intraosseous injection instead.